In this video, I'm going to demonstrate common physical therapy exercises that are often used in the first 6 weeks after having knee replacement surgery. Ankle pumps can be performed when you're lying down or sitting up. All you're going to do is point your feet down like a gas pedal and then bend them up towards you as far as you can. You can do 20 repetitions at a time, and I like to aim for every 10 minutes, so you can't overdo this, so you want to do this throughout the day. Heel slides will be crucial in regaining your bending range of motion for your knee joint. You can do this exercise in a sitting position or a lying down position. Now, with this movement, I'm doing active range of motion, so I'm using just the muscle of my leg to bend the knee. You can also do active assist, where you use a belt or a strap around the ankle and you pull with your upper body to bend your knee and assist, or you can even cross your opposite leg in front to help pull that knee into more knee bend. Now, in terms of tolerance, you don't want to push into extreme pain, but you will have some discomfort, so you want to push just to where you can tolerate the discomfort, but you're not really trying to push into a lot of pain. Quad sets can be performed in a sitting or lying down position as well, but the leg will be fully straight, and your goal is to squeeze your quad muscle, your thigh muscle, while bringing the knee into a fully straight or extended position. So you can imagine you're trying to get the back of your knee to touch the floor or the bed, whatever surface that you're performing this movement on. Glute sets or glute squeezes can be done either lying down or sitting. And in terms of having the knees bent versus straight, that's more of to your preference. And some people find one position more comfortable than the other. But in this video, I'm performing the glute squeezes with my knees bent. Now, the goal here isn't to lift up your hips off the ground. It's just mainly to squeeze your glute muscles and feel both glutes squeezing independently, but you're squeezing at the same time. So you want to work on the activation of the glute muscles themselves. Hamstring sets can be performed while lying down on your back, preferably on the bed, so a soft surface that you can comfortably dig your heels into. Now, you don't have to have your knees bent to 90 degrees like I do. You just want a slight bend in the knees. And in terms of digging your heels into the bed, you don't want to push them straight directly down, so perpendicular to the bed. You actually want to have a little bit of a pull where your heels are almost pulling towards your body. For short arc quads or SAQs, you can perform this movement while you're lying down on your back, or you can be sitting up how I am, but your leg must be in a lengthened or straight position. And what you want to use is either, if you have a foam roller, you can put it underneath your knee, or roll up a towel that's about this size and put it underneath your knee. And what you're going to work on is trying to squeeze your quad muscle to straighten out your leg as far as you can. For LAQs or long arc quads, you're going to perform this while you're sitting at a chair or at the edge of the bed. And this is similar to a leg extension machine. So you're just trying to straighten out your leg, but it's just a greater range of motion. So your knee is starting from a more bent position, but you're still trying to focus on squeezing your thigh muscle. For straight leg raises, you're going to lie completely on your back on the bed, and you're going to start off with that quad set. So you're going to tighten up your thigh muscle, and then while holding that, you're going to raise up your leg off the bed. Your goal is to aim to the height of your opposite knee, but initially you might not be able to lift that high. So if you can get up to even halfway to the shin, then that's a good height, but eventually your goal is to get to the same height as your opposite knee. Prone hip extension, you're going to be lying on your bed while lying flat on your stomach. One of the most common mistakes people make with this exercise is they'll overcompensate by using their lower back muscles, which can strain their low back. But what I want you to focus on is doing those glute sets that you practiced before. So you're squeezing your glute one leg at a time just to raise up your leg, so it's not coming from too much of your hamstring, but your goal is to use your glute muscle to lift up your leg. And height wise, you don't have to go too high, even a few inches would be just fine. For sideline hip adduction, you're going to be lying on your surgical side. So in this video, I'm lying on my right side to mimic if I had the knee replacement on my right knee. Your opposite leg, so my left knee in this video, is in front of me, knee bent and foot on the bed for you just to keep you stable. And then your surgical leg that you're lifting, knee is completely straight, and your goal is just to lift it a couple inches off the bed where you're feeling your groin muscle working. For sideline hip abduction, you're going to be lying on the non-surgical side and raising up your surgical knee. So in this position, you're going to be lying completely on your side on the bed. The bottom leg, the non-surgical leg, is bent to keep you stable, and then your surgical leg, knee is fully straight as you raise up your leg towards the ceiling. And then one of the most common mistakes people make is when they raise up their leg will be too far out in front of their body. I want your leg to be in line with your trunk. Prone hamstring curls. This exercise will be very simple to perform. You're going to start off by lying on your bed, flat on your stomach, and we're going to work on two main things here. One is trying to improve that early activation, so turning on your hamstring muscle even further. Second is going to be increasing that bending range of motion for your knee joint. So as you improve your ability to bend your knee using your hamstring, we're going to try to push that range of motion even further and further, almost like you're trying to get your heel to touch your butt. Standing hip abduction. This exercise will be performed definitely on both sides. So for example, here, if I had surgery on my right knee and I'm standing on my right leg, I'm working on the stability and the weight bearing for that surgical side. Now, as I switch sides and if I stand on the left, then I'll be working on the hip abductor muscles as I kick out my surgical leg to the right. Your goal is to maintain an upright position, and you can use a wall or a walker or the kitchen counter for a little bit of extra support. With standing marching, our goal is to continue to progress your ability to stand on one leg. So we're challenging your knee stabilization while you perform the marching movement. Now, when you do this exercise, stand in front of either a wall or the kitchen counter just to give you a little bit of balance and support, especially early on when you're practicing this. And your goal is to do this nice and slow, so you're not trying to lift up each leg as fast as you can. The slower that you can and hold this position, the better. At this point of your recovery, you've gotten better at doing sit-to-stands where you might be using your arms to help you stand up from the bed or a chair, but we want to focus on improving your ability to use your quads, your glutes, your leg muscles to help you perform the movement with minimal assist from your hands. So while standing in front of a wall or the kitchen counter, you will want to work on doing these knee bends or these mini squats just to use a little bit more of your leg muscles to do the movement, making sure you're not letting your knees go too far past your toes. For heel raises, you'll stand next to the kitchen counter or a wall for support. Your goal isn't balance. Your goal here is to work on lifting up your heels as high as you can in a controlled motion as you go up and down. The most common mistake people make with this exercise is as they go up, the outside of their ankles will flare out to the side. So you want to make sure that your toes and your ankle joint is in a straight line. If you haven't had knee surgery but suffer from tight hamstrings that might be affecting your knee pain, watch this next video for an effective method other than stretching that may reduce your hamstring tightness.